Welcome to the Healthy Heart Show, where we pull back the curtain on conventional medicine and dive into the root causes of cardiovascular health. If you are concerned about high cholesterol, high blood pressure, heart attacks, stroke, or atrial fibrillation, this is the place for you. We will provide natural heart information that will help you prevent, treat, and reverse any ailment, leaving pills and procedures out of the picture. Here are your guides to holistic heart health, board-certified cardiologist and Amazon best-selling author, Dr. Jack Wolfson, and natural heart doctor, naturopathic physician, Dr. Lauren Latanza.
Hello, everyone. Dr. Jack Wolfson, cardiologist at Natural Heart Doctor. Welcome to another episode of The Healthy Heart Show, where we give you the best health information so you can get the best heart health and achieve the 100-year heart, which is our goal for everybody here at Natural Heart Doctor. And so with that, we usually bring on some fantastic guests. And today I've got another wonderful guest for you. Friend of mine, Dr. Stephanie Rimka. Dr. Stephanie, how are you?
I am so great, and I'm so excited to be here. I've said it before we started talking, but I have been a huge fan, and thank you on behalf of all the doctors of chiropractic and our patients that we have a strong voice in medicine with you. I deeply appreciate it.
Well, thank you. When I first, got together with my wife and her being a doctor of chiropractic, she told me, you're going to learn the truth. You're going to become a DC, doctor of cause. You're going to lose a lot of friends along the way, your old MD and DO buddies, which is true. But again, it brought me in touch with real doctors like yourself. So again, appreciate having you on. And again, remember everyone, everything that we discuss in every episode, it certainly links back to the heart. So Dr. Stephanie may be talking a lot about things related to the brain, maybe we're talking about trauma, maybe talking about different emotional issues. But again, as we help to work on that, that all goes back to helping the heart. So Dr. Stephanie Rimka, BA, DC, BCN, is a holistic brain optimization specialist, focusing on integrated neurotherapies to identify and address the root cause of mental illness. Imagine that, a root cause doctor, love it. Learning disorders and chronic illness. She looked very, very young, but she's dedicated over 25 years to learning the best practices in functional medicine from so many different fantastic mentors that she's been around. She does see clients one-on-one. When you go to her website again, that she'll tell you about, again, it's called Brain and Body Solutions, and we'll put that in the show notes as well. But again, when you go there, she's got some fantastic group courses, group retreats. Maybe you can tell us about the one. I think you guys do one in Africa, and then ultimately she also her why and her passion certainly, I'm sure, is her teenage son Bennett. So again, welcome, Dr. Stephanie Rimka.
Thank you. I'm so excited to be here. Let's get to it.
All right, let's get to it. All right, so give us some of your background. Tell us your, every superhero has the origin story. Tell us yours.
Okay, well, the net it. I always thought I was going to go to medical school. I always wanted to be a doctor. It was very clear-cut choice for me. I was a very successful student. I could fall asleep in class and still get A's. It was not hard. Memorizing a bunch of information and regurgitating it was a simple thing. And that's typically all biology is, just rote memorization, spurt it back out at these people, and you're supposedly smart. So that was what I was going to do. I had a little bit of a detour in a high school soccer game. I hurt my back. I ended up at my best friend's brother's office, which was a chiropractor, at 16. So I started getting adjusted. I really didn't understand what he was teaching me in every appointment. I just knew I felt banging and I could crush my basketball and soccer games. I got adjusted before my games. I got adjusted after the games. I got adjusted before I went to parties. I just felt energized and amazing. Okay. He just kept me together through I was a very aggressive physical player. In college, however, I ended up breaking L5. I broke my spine, herniated a disc. We had a lot of paralysis and ended up in traction and all this stuff, and was told by a neurosurgeon that, you're clearly never playing sports again. You're not running again, and walking is even in question at this point, because I lost complete motor control even of my right leg. So that was scary, but I basically still at 19 had so much vinegar in me. I looked at my mother and was like, yeah, I'm not buying any of that nonsense. Get me to Keith right now. So Keith is my chiropractor in Michigan, and continued starting to going, still not listening, was a horrible patient off and on. I only went when I was in pain and I stopped going. I would go in pain, I would stop going. But in college, it led to, a little bit of a whole crash after I broke my spine, that my thyroid crashed and I just started getting really sick. Turns out I'd chosen to become a vegetarian and I didn't put the pieces together until much later, that this is why I broke my back. This is why my thyroid was crashing, because I had no animal protein in me at all. But I didn't figure it out. And I just saw how horrible the healthcare system was at my school, that I kept going. I kept saying, they couldn't figure it out. And a year into this, after I gained 50 pounds and I'm exhausted, I'm sleeping 20 hours a day, I'm struggling to do basic math and chemistry. A friend of mine said, have they checked your thyroid? Because I have a thyroid disorder. Maybe it's that. And I'm like, oh, I don't know. Let me go ask. And it turns out they never did it. I was a classic case. I'm thinking, I don't know what kind of idiot doesn't figure this out, right? So I kind of had a existential crisis moment in my junior year, like, why am I actually wanting to go to medical school? Why do I want to be a doctor? And I was a really poor kid and grew up on welfare and with a father in prison, my mother working 3-4 jobs, and we still needed food stamps. Okay. So I had to really evaluate, is this all ego? Is this money? Is this the path that I think is going to rescue me and my family? Like, because it's, what else do you be? A doctor, a lawyer, a judge? I don't know, what else is there? And I paused. I said, I need to reevaluate this whole situation. What's my motivation? And in that time, I said, I'm going to take a year off before medical school and really decide. In a conversation with my chiropractor, I said to him, I said, here's the thing, Keith, I can't understand what's happening. When I come here consistently, I'm so much happier. I see the world completely differently. Like, my connection to my spiritual self, the universe, something's totally different. Colors look different. Everything, I just interpret everything very differently in a very positive light. Why is that? That doesn't make any sense. This can't be about my back pain. And he had an aha moment where he shut the door, pulled out a Sharpie and started writing on the whiteboard. And this guy saw 200, 250 patients a day. So he had, decent volume. He was banging it. I mean, he had 20 people waiting. He took 15, 20 minutes. I don't know. Time stood still. And he was breaking it all down. And he talked about, universal intelligence, innate intelligence, consciousness, the chakras, energy, the whole flow. And he brought neurology into it, of the afferent and the efferent and emotions. And I stopped because I was working in a hospital with schizophrenics, in a mental hospital in Michigan at the time. And I said, wait, you're telling me the schizophrenics need to be adjusted? And he goes, yes. And I said, oh my God, that's it. That's what I'm supposed to do. What do I do? He goes, you moved to Atlanta. I said, okay. And 6 months later, I moved and I enrolled in Life University, all with, I want to help drug addicts like my brother. I want to help guys in prison like my father. I want to help the schizophrenics that I was seeing being thrown away and abused and just over drugged. I was like, this can't be the solution. There's got to be something else. In my naivete, I thought chiropractic could perform all the miracles and make schizophrenia go away. I learned that wasn't true. However, I learned what to do to make it go away. So that's what kind of got me here, little series of events that added up to me going, oh, my mistake. And he had a very strong conversation with me. He said, let me be real clear. You need to know if you're going to become you need to know me since I was 5. He's like, if you're going to become a physician, Stephanie, I want you to be the best physician out there. Go do it. If you need that white jacket and you need that respect and you need that ego boost, it's okay. Go do it and be the best surgeon out there. However, if you choose this path, you're going to be a salmon swimming upstream. You need to be okay with no respect, with being criticized and ridiculed. Just know what you're doing. And so I was like, oh yeah, I had to meditate and I'm like, I'm good to go. I'll be the black sheep. I'm okay.
Like you said, it's unfortunate that, again, that you're the salmon swimming upstream, because what are you swimming upstream against, right? You're swimming upstream against big pharma, big medicine, big insurance, big food, big ag, big corporations. That's what we're swimming upstream against. Even myself as a natural cardiologist, that's what we're up against. But fortunately for us, on our side is the truth. On our side is common sense. And that's why we get such fantastic results. And I know, obviously, that your patients, your clients, people that are connected to you are just getting the absolute best, because they are, again, getting that comprehensive approach. And it's not a matter of, well, here, let's try this pharmaceutical, and this pharmaceutical. So I think that's
even this supplement, this supplement, this supplement. It's even tricky in this root cause field, where you can eventually still be looking at treating symptoms and suppressing things just with whether it's, oh, so it's methylfolate we need, oh, it's niacin we need, right? Oh, it must be glutathione is the cure. Oh, maybe it's this new peptide. So there is this balance of, it's a trick with patients, because I was one too, I was a patient, and brainwashed in the thinking of, you're not supposed to trust yourself. You're not supposed to trust your senses. You're supposed to ignore your body's signals. You're supposed to listen to some authority who knows more than you about all of the things. You should avoid your own common sense, because you clearly can't know what the guy in the white jacket knows about anything. And that kind of gaslighting's been going on, especially for women, for eons, right? They've been told there's no such, their pain in the periods isn't that bad. All kinds of things women have been told, right? I mean, as a cardiologist, they get ignored in the emergency rooms and die of the heart attacks more. They just aren't taken seriously. So I'm working against that whole model that they've created, where they've normalized culture. Like, we don't even realize how much we gaslight ourselves, how much we silence ourselves, how much we've disconnected from the natural way of being. So although I bring tremendous technology and devices and all these fancy things, all of those are really an attempt to reset the system back to the way it was designed. It should be in nature. I'm pretty sure nobody in the Hadza tribe needs a thing I do. They don't need me. And I would like to get it to the point.
Except for the adjustment factor.
Yeah, well, there's that. And even that, I sometimes, I do wonder, the subluxation, as you want to call it, it's just a potential energy, right? It's looking at motion. And so can we, of course, be taught to self-correct at times? I think it's there. I think the opportunity that we can move that stuck energy ourselves is there. And I think they have a lot of their rituals involve a lot of movement, involve a lot of sound, and they're creating frequency that actually probably is self-adjusting. I don't know how many of them. Now, I've been into the Brazil and Costa Rica and Mexico, and I've done mission trips, and I've seen some things that I can't even believe that I've adjusted. But I don't know. I wonder about that, to be honest.
Well, I guess to continue on this, and certainly this is not my area of expertise, and it's an interesting, I guess, philosophical question, but ultimately, the way that I see chiropractic and the chiropractic adjustment is that, listen, trauma happens, and again, not all trauma, certainly not all trauma is good, and therefore that trauma that happens, can your body do it on its own? Or is that a place where osteopathic manipulation, physical manipulation, chiropractic adjustments, can it help? But I see your point, and that's definitely interesting. I'm going to err on the side of thinking that the chiropractic adjustment's going to be helpful, but
it's actually going to be helpful.
I'm a huge cheerleader for chiropractic, as you know. So.
Yeah, I love it. I love it.
The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor. Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology Coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com. Now back to the Healthy Heart Show.
So you also, you talked about, hey, listen, obviously pharmaceuticals, yes, pharmaceuticals have a time and a place, and emergency room doctors and trauma surgeons, they're all totally necessary. And pharmaceuticals, when someone is really on the verge of catastrophe, although again, not my area of expertise, but there may be pharmaceutical interventions that help people, I guess, literally and figuratively talk them off the ledge. And then you brought in supplements and saying, well, again, we don't want to be supplement pushers on that same end. And I think you'll agree with this comment, and tell me again if you do or don't. But Supplements supplement everything else that we do, right? The eat well, the live well, the think well. Inside of live well is sleep and sunshine and chiropractic and physical activity and toxin avoidance. And then again, we can use evidence-based supplements to help again supplement again, everything else that's so foundational.
Mhm. I agree. And because I use a lot of supplements, don't get me wrong, but if you're dealing with bipolar, schizophrenia, autism, dissociative issues, I mean, we have real deep biochemical mismatches happening. And there's a lot of epigenetics involved with that. And there's usually some type of chemical trauma that happened to kind of set this cascade of events off. So I'm typically not blessed with getting the 3-year-old and saying, let's run everything and let's look at the whole family history. I'm usually seeing a 22-year-old who's now schizophrenic and, like, okay, so I am going to leverage supplements, nutrients, and as a therapeutic role. And my goal is absolutely to get away from all the pharmaceuticals if possible. I used to think that was my primary goal. Sometimes if I can go from 7 to 1 and a handful of supplements and they're no longer schizophrenic, technically, they can go to school, get married and be well and have a productive life. I've won. Okay. It's winning. I used to think that was a failure years ago because one on the market that people don't like, but lithium is a potent. There's 3 salts, 2 are natural. I use lithium orotate, a natural supplement, a lot in the mental health scape. It's very, very potent and can be a miracle for people. So
hold on. So I want unpack that more, if you would. Tell me more about lithium, because again, my multivitamin, we've got a low dose of lithium in there. We use a product from Biotics Research called Lyzyme. And I appreciate that for my cardiovascular patients, certainly as it pertains to people, whether with high blood pressure, certainly people with atrial fibrillation. Tell me more about lithium.
So lithium is just involved in a tremendous amount of brain transmission and neurotransmitter function, and particularly if somebody has some of the genetic SNPs, the variants like COMT, which is a methylation variant. People are familiar with MTHFR, COMT, if they have methylation's very hot, and I think it's over amplified right now, however. But that one in particular is pretty potent. A little bit of lithium goes a long way. I do hair testing on this to look at heavy metals and the lithium content, and coupled with some other labs, you can see a picture of if lithium will probably work really well for this client or not. And to go with an over-the-counter supplement, a natural occurring salt that's out there, we start that. Typically, if I see the response that I want, we can usually stick with the natural supplement and not have the medication. But let's say I have a patient that's come in on the pharmaceutical version of lithium. It's just a different one of the 3 versions. Instead of it scaring everybody, I'm like, hang on, it's okay. So I might usually I'm going to titrate off of everything else first once we start doing the neurofeedback and other brain therapies to stabilize their brain, to bring stability back to it. Lithium, we may or may not get off, or I may get them on the natural version. But typically that person, if lithium has worked well, it's because they have a true epigenetic need for much higher doses than you or me, right? So you do have genetic variation. Schizophrenics often are going to need more lithium. They also need more niacin typically. They might need 100 times the amount of niacin that I need or you need. And so you can't get that from the diet. I can't explain why this happened. Is it ancestrally being passed down through their DNA from trauma from 8 generations ago? I don't know. All I know is I can give you this cocktail and there's no longer hallucinations. They're no longer hearing any voices, and they can have a life and be happy, and everything's done. But I'm like, you got to stay on these things. It is kind of their prescriptive thing. Like, you need an excessive amount of it, because if they don't, we'll have neurotransmitter conversions. We end up with excessive dopamine. We end up with really high histamine, things that cause derangement in their perceptions of reality, basically. So I love lithium orotate. My advice though, I usually want people to be seeing a clinician to help determine these types of things. Something like a lithium, even the B vitamins, even methylfolate. People will take SAMe like it's nothing without understanding. If they have high homocysteine, and you can probably speak to that more, they're going to push the system into a very dangerous state by taking these methyl donors. So I get very nervous with people just looking something up, or, oh, this worked for my friend. and they take it and they have a really bad response and they don't understand why. So nutrient supplements are very potent because we're moving biochemical cycles, and you can, by taking too much zinc, you can change the whole dopamine to norepinephrine story. By taking too much copper, you can, it's tricky. And I do think people need to understand it's powerful. Nutrients can move like therapeutic drugs in the system.
As it pertains to lithium, when people, because most people have a negative stigmata against, lithium. But wait a second, I thought it's used, for schizophrenics and people with bipolar. And what I tell people, listen, this is over 1,000 times lower dosing. Typically, what we use on our side, sometimes we go a little bit higher or even much higher, but nowhere near that kind of level. And what I tell people is that they're just lithium deficient, that the farmers are not putting lithium in the soil. They're not growing food with lithium. The animals are therefore deficient with lithium. So this can, again, kind of give you that basic, foundational lithium that so many people are really, missing.
Yeah. It's just our perception of it. We've been told to be afraid of it. We haven't been told to be afraid of magnesium. Either they're all still elemental minerals.
It's just another elemental mineral on the periodic table that we all saw, in high school. All right, so you mentioned, again, as we, this is the Healthy Heart Show, and so many people I get to, I try and make them understand that think well aspect, that emotional health totally plays into cardiac. Again, even women with a spontaneous coronary artery dissection, highly associated with stress. Takotsubo cardiomyopathy, highly associated with a stressful situation. And again, obviously blood pressure, AFib, heart attacks, strokes, all higher in people with, I guess, mental health issues, or again, anxiety, stress, anger, depression. So how would you approach a patient who comes in maybe with one of those diagnoses? Clearly, they're not as acutely ill, per se, as some of the people you specialize in. But again, as we address most of the people that are listening to us right now, and they've got some of these emotional issues, where do we start?
The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor. Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology Coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com. Now back to the Healthy Heart Show.
That is the majority of what I do all day, every day. I do start right in the brain. However, I do bypass the heart a little bit. I sneak the heart in every session. Anytime I'm going to do something, we do heart rate variability training. So I do biofeedback. I hook them up to a pulse ox. I see what their pulse ox is. I address breathing. I teach them how to control their vagus nervous system, which is the master controller of the parasympathetic rest and digest. So I teach them through breath, through the vocal cords, so they can learn to hum, they can learn to chant, they can learn to sing, they can learn to laugh, as well as gargle. These are main vagal tone activators, right? As well as breathing. So we go through breathing exercises, and typically I'm going to use some type of heart rate variability training, such as heart math, right? So I've been using heart math for a very long time in practice. There's a couple other online apps I'm playing with that might even be a little bit better, to be honest, that I'm not quite ready. I'm like, ooh, this one's really bizarre, because I'm hooking them up to EEGs as well. So I'm watching brainwave activity while they're doing heart rate training to control through breath and through emotional state how their heart is beating, and how the heart synchronizes to the brain. So I do go after the heart. I kind of use the brain access point, because people seem to, we're obsessed with the brain, right? We're very left hemisphere. We kind of like that. The heart, it makes people think I've loved a little too much sometimes, Jack. You know what I mean? I have to ease my way around that. So I get that synchronized to the heart, because the heart rate variability is going to control the alpha waves of the brain. So what I'm trying to do to bring that emotional over arousal down is what it's called. Like they're just all amped up and sped up, and they're in a primal, primitive, animalistic part of their brain instead of the higher cortical regions, the more higher consciousness regions that have impulse control and compassion and empathy, and where all the mirror neurons reside. I use that to start slowing them down from these high, fast beta waves, which are externally focused and worrying and thinking and, oh my gosh. We've got to start slowing it down. We've got to go from really fast running beta down into some alpha. Then if I get them really, theta is the meditative sweet spot. Delta is the deep sleep, and super advanced meditators do go into Delta. They do these bizarre gurus in the Himalayan mountains. I don't think I've ever taken myself to that place in 20 years, but maybe one day, right? So I access that through some technology and kind of letting them be relaxed as to how I'm doing it. And then over time, teaching them how they can do that themselves and creating the portal to teach them they need to start meditating. Americans seem to be very resistant to the idea that they can do this themselves. They have to slow it down in silence. And all that beta is the left hemisphere, chatter with words. The left hemisphere is 6 times slower than your right hemisphere. The right hemisphere is all symbols and pictures and intuition, basically. And it's much higher consciousness. And it is the doorway to joy is in the right hemisphere. That's where it's made. And it is the doorway to getting to the part of the left hemisphere that deals with compassion and empathy. So it's a slow route, how I kind of have to teach them through silence and gratitude to open the right hemisphere, silence to stop all the talking. No. Like I just say, just use your mind and go do this. We use breath. And so it's a slow process to get them into, oh, I don't need to tell you all my problems, and I don't know, we're going to do a whole different thing here. And I leverage the technology to show them right in the screen. See what you just did? See how when you did that, this is what happened. See how when you thought of, your boss, everything went haywire. See how when you thought of your divorce, look what happened to you. See how when you thought of, the puppy or being on a beach, see how you can control this? So when people see that they're in control of it, it does empower them to actually start practicing it. And through repetition, I hook this link up to, you got to do this stuff over and over again, neuroplastic, right? So these connections. Then I can get into the first part of any brain training is stabilization. And it's just the nuts and bolts, stabilize. Once I'm stable, then I get into the deeper trauma healing and the more hypnagogic, deep spiritual consciousness elevation stuff. This is the meat and potatoes. This is what we all want to do. This is where people have enlightened things. You can have basically almost like psychedelic experiences at times. And I can do in 3 months to someone's brain what 20 years of meditation would take. And then they can become a very good meditator on their own. Because people often quit. They think, I don't know how to do it. I can't quiet it down. I don't know how to, I suck at it. This is what I hear, right? And I'm like, oh, let me help hijack this and make it faster. Let me throw on a V light and put you right into alpha. Let me put on a transcranial stimulation. I'll throw you right into theta. I'm going to do it. I can put you right there in a few minutes. And then they'll have that feeling, oh, I'm like, I know. And I've had patients get off and they go, I don't think I've ever actually felt calm in my life. I said, now you feel that feeling? They're like, yeah. I go, that's what we're going. That's normal. That's what we're going to get you. We're going to keep moving you back to peace over and over. But they've become the neurological addiction. You can very much become addicted to anger, very much become addicted to anxiety. And you can't get yourself off of that biochemical addiction. So we have to sometimes use stronger things to break it up. I use a lot of technology, neurofeedback, integrated listening, light therapies. You can do it also in silent retreats for 10 days, or a sweat lodge, or a chanting circle, right? There's many ways that this has been established throughout our history that we've used ritual and ceremony to break up the neurology and start to slow it back down, bring you into, I would say, into the heart of the brain, which is the pineal gland and the pituitary gland. So that's how I kind of see what the heart really is. It's, here are my 2 temples on the side of my eyes, and the church, truly the true temple is inside the brain. So I'm of the group that goes to the pituitary, and the pineal is actually, I'm going to say it supersedes the physical heart, but I don't see how you really can connect them. There's a communication that's always happening electromagnetically. And I am always been fascinated that the heart has its own system. It's got its own set thing that it can do and self-generate, which is fascinating.
Well, I mean, so a lot of what you do, again, it's, I guess when I think about how we help people recover from childhood trauma, emotional trauma, I just kind of think about, I don't know, like it's almost like this movie setting or whatever, like that, here's Dr. Freud and Sigmund Freud, and you're on the couch and he's like, tell me about your mother, again, like just trying to unpack all this stuff. And I think what I've learned, at least over the last couple of years, is that, yeah, we don't need to revisit all that stuff.
No.
And in fact, revisiting all that stuff, as you pointed out, when you're doing neurofeedback on people, that, that it really makes people get acutely worse if you're just talking about it. But then again, understanding, all right, we've all got this old baggage. It's just a matter of how do we deal with it going forward, right?
Yeah, it's typically, I leverage talk therapy with my patients. So I want to be clear on what I say. And I work with a tremendous amount of amazing talk therapists that refer to me, and we co-manage together. They've gone through all the neurofeedback in my office. They understand what it does. So it's not to bash that, but in general, many of the styles and techniques are just re-traumatizing. And we have the great analogy, everybody knows, why don't most women prosecute their rapists? Because they cannot go through telling that story another 50th time, 60th time. It's traumatizing to have to keep saying it over and over again. And you're ingraining what you practice grows. So if you keep practicing telling the story of your pain, your victimhood, your trauma, you're going to grow it larger and larger, right? Throughout not only your brain, your entire bioenergetic field. So I'm not a huge fan of that. Usually what comes to me are like these talk therapy failures at this point. So I leverage a few techniques that are really, really good. I go after it through getting it out of the body physically. So again, chiropractic, my style that I do is very spiritual, kind of energetic. I do a lot of hands off in the field, chakra, pranic healing, cleaning the whole energetic system. I can see things in the field that maybe a lot of people can't. I can feel in my body what they're feeling. So it just gives me a faster way to get to it. You don't need to talk. I can already feel it. So let me just address it. That's just something that I was trained into. So there's that whole aspect. So something like Trey, which are the tremor release exercises, or myofascial release, or Rolfing, you can physically start getting this out without having to say a word. There are many techniques that help this. Acupuncture can do this, right? If it's blocked somewhere, it just goes and you can just deal with it. Neurofeedback and alpha theta training, deep states training, it's often called. We're dipping people. So when you fall asleep, there's this space right before you fall asleep where your alpha and theta waves are doing this weird crossover. So you're kind of conscious and not conscious. And it's like this twilight space. You're usually there for 1 to 2 minutes. Memory recollection is off the charts. It's often where people will go, oh God, I forgot to do da 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 da. They'll remember something that they forgot to do. Either they get up and go do it, or and then they fall asleep and they wake up and they don't remember, what was that thing I was supposed to do, right? So it's this twilight state that's very, very special. Well, with neurofeedback, with sound tones and your eyes closed, I basically put you purposely in that state for 30 minutes. And it takes you deep into your unconscious. Your unconscious is in total control, and you will never, ever show yourself something you are not ready to handle or heal. So in a series of sessions over time, without you thinking about it, your unconscious goes down there into the things it's been afraid to see, and it cleans it all up, wraps it up, puts it in a nice bow, and presents it to you, where you suddenly can go, this is countless examples of PTSD, of veterans with PTSD, or alcoholics, or child sex cult member patients. I've had a lot of those. They can suddenly see the memory or the whole situation from a very observer, witness mind point. And now they can tell me about it, and they have no stress and they have no trauma, and they're very detached from it. It's like watching a movie, and then the trauma's gone. The hold it had on them physically and neurologically is now gone. They remember it happened, but it no longer controls them, and it's done. They don't make decisions based upon a wound and a pain any longer. And that can all be done with really not a whole lot of talking. We do a little bit of visualization, and we do journaling, and it's just consistency. And we allow the body to heal itself. The power that made the body will heal the body if you just allow it, you put it in there. So you can remove all kinds of things in a very potent way that's very comfortable and casual and relaxed for the client.
Excellent. So, I mean, again, people are learning so much about, the power of, of the mind and what we can do to use kneeling, natural healing, whether it's from food, from lifestyle, and again, some of these other ancillary techniques to be able to help people. And I love when you mentioned also about laughing and all these different, what we would say are like autonomic balancing techniques as we try and decrease sympathetic, increase parasympathetic, and, laughing. And you and I were talking before we started how, we personally, we live in Colorado, but the practice is in Arizona. So we often travel back and forth. And for that, 11 to 12 hour car ride, we spend so much of the time listening to the Comedy Channel and just laughing and laughing and laughing. And it's just, it's so therapeutic. That being said, again, so as people really identify that maybe they have to, there's a lot of emotional things that they have to work through, or as we say, hey, listen, emotional wellness is an issue. We can have people fill out questionnaires and talk to people, my practice certainly, because again, when people come in to see me for high blood pressure, diabetes, heart attack, obesity, stroke, AFib, whatever it may be, they're not thinking about the emotional side. As I bring up the emotional side, then now we need to get them to work with practitioners like yourself. So kind of what is the gateway, or what is the best way for, again, someone who's listening to this podcast, who's listening, or who even comes to see me, how they can work with you? Tell me about your courses. Tell me about the Africa retreat. Tell me about that.
Okay, yeah. So the Africa retreat is coming up, and we have a couple more spots. So that's in April, end of April. It got moved a few times because of the whole pandemic situation. Safaris were shut down in South Africa. That's designed as a reconnection to nature. So there is no electricity. There will be no cell phones. No, you cannot work. You cannot, that's it. I'm pulling into nature, into the Mother Earth for 8 days. It's an eco safari, open tents, sunrise every day, sunset every night, eating by a campfire. We'll have yoga, meditation, sound healing, lots of things in silence, lots of things about going within. So to me, the answer to everything is really, people may be able to fire more of their therapists and doctors if they went back into nature and let her heal you, right? If you connected more on a daily way. So that's what's going on there. My website is brainandbodysolutions.com or drrimka.com, and you can see about the retreats there. In my courses, so I have a series of courses. Most of them are for women, but there are definitely some do-it-yourself courses, like my sleep course or the immune course. Couple of things, but I have kind of like a year-long journey for women if they're interested. So the 3R course is the 3R reset. It's rest, restore, renew. And I do focus on a carnivore diet for 90 days. I focus on the idea of what it means to rest, because people don't seem to know how to do that anymore, especially women. Like, we're not waking up at 4:30 to go to the gym, mama. This is not working for you. Okay. It's really about nourishment. So I go through a lot of visualization, journaling, talk about I do a lot of neurology. I talk about the neurology of trauma. I have a whole prisoner of neurology series, and I go through why you might be stuck in what you're going through and ways to address it. I teach a lot of alternative methods and resources. You're in that resource, actually. You're one of my low carb cardiologists for people to resource. Then the next course in there is the M1, and it's all technology. The 3R course is about putting women back in their body. Stop dissociating so much. Let's nourish you. Let's mother you. Forget about your kids for a hot minute, please. Take care of you and sleep and eat again. Stop with the dieting and the salads, right? Then I go into a lot of technology in the M1. And I go through a lot of unknown therapeutics and devices and many things I'm not allowed to speak about publicly on social media, things I do on my patients. I put you in my mind. I show you case studies. I show you brain maps. I show you labs. I show you, this is what it actually was. Let me show you it took a whole year, but this is what we did. And teach you, ozone therapies, all kinds of things, all kinds of electromagnetics, and a lot of physics is in that course. And then M2 is more of a shamanic into the heart course. I do a lot of experiential Zooms with women. So it takes a whole year to kind of go through that whole thing. If they're interested, you don't have to do the whole thing. So that's on my website. And then I do private sessions, and I've finally broken into doing neurofeedback and other brain therapies remotely. So because I was having a very hard time helping, I see patients all over the world and finding them somebody that's board certified in what I do, during COVID has been really tricky. And it turns out a lot of practices closed, or they're not seeing people, they're not accepting patients, or none of my people want to wear a mask, and I don't want them to. So I'm like, they want you to wear a mask to do neurofeedback? I'm like, that kind of defeats the whole point of you going for anxiety, wearing something that's going to make you more anxious. So I'm not down with that. So I had to get on board with finally accepting remote neurofeedback. So I do several brain therapies. I can see patients from anywhere, send you the equipment, monitor you remotely, and you can do neurofeedback or sound therapy, cerebellar work, light therapy, all kinds of brain restructuring work remotely with me from the comfort of your home. So that's all on my website.
Absolutely fantastic. So the website, again, you said Dr. Rimka, Rimka, and that's DR. And then, of course, brainandbodysolutions.com, where you can find out about the courses, about retreats, about neurofeedback, different supplements and different products that Dr. Stephanie recommends. And of course, all of her backstory is on there as well. Fantastic informational website. So fantastic. Dr. Stephanie, you said your information is in courses that last a year and or longer. So again, I appreciate, the opportunity to have you on in this short bit, just to give people like a little taste about what practitioners like you can do, what people need in order to achieve the healthy heart, the healthy brain, healthy and happily they're 100 and beyond. All right, well, wonderful. Dr. Stephanie Rimka, thank you so much. I'm Dr. Jack Wolfson, board certified cardiologist, natural heart doctor. Another episode of the Healthy Heart Show in the books. We will see you all next time.
That does it for today's episode. Thanks so much for listening to the Healthy Heart Show. Please help us get the word out by liking and subscribing to our podcast and our Facebook page, Natural Heart Doctor. Please show support for our podcast sponsor, Cardiology Coffee, your resource for organic, antioxidant-rich, mold and pesticide-free coffee shipped straight to your door. Learn more by adding @Cardiology Coffee on Instagram and visiting cardiologycoffee.com. This podcast provides materials for information and educational purposes only and should not be considered medical advice. We encourage you to contact your physician for any of the health issues discussed here.